Biosimilars in general, I think, are an important part of having a more robust infrastructure to support our patients. And just like when you move into a city, you hope there's a lot of gas stations and you hope there's a lot of stores you can go to, you want to have a lot of diversity in the availability of different drugs. Number one, it keeps competition healthy, and it allows for better pricing structures that we hope will evolve over time. The big concern, of course, is are these drugs really equivalent? Are they similar? And it's difficult with biosimilars. With chemical structured drugs, one can have the exact same structure and you have some degree of confidence that it's the same drug. But with biological drugs, there are many variations, particularly with things like antibodies and more complex structured drugs. So the threshold to get a biosimilar approved is not the same as getting the first version of the drug approved in the first place, where you have to do large randomized studies and you have to show multiple endpoints. With biosimilars, you have to really show that the primary endpoint or one of the co-primary endpoints is the same. In the case of many biosimilars used for advanced breast cancer, it's really the response rate and not so much the progression-free survival, which requires more time and more patience. And then you also have to show that in terms of pharmacokinetics, it's similar, that the toxicities are similar. So there are other thresholds that need to be met, but obviously they're not as high as the initial drug.